Public health officials have long recognized the need to address rural health disparities. In this study, we evaluate health behavior-related programs, resources, and services available to farmers and their families in Ohio's rural communities. Farm and rural populations have higher rates of age-adjusted mortality, disability, and chronic disease compared to urban and suburban counterparts. They are also at higher risk for work-related injury, lung disease, and skin-related disease. Not only that, the stress of the occupation can also cause an increase in the chance of mental health problems. Farmers experience additional barriers to healthcare access based on their location. There is very limited data available about the availability of health services in rural areas. In our study, our objective was to identify health behavior interventions and services available to farmers and their families, and identify barriers that healthcare organizations and agencies have to providing these services. Our study was a cross-sectional descriptive study that surveyed key informants at rural health clinics, critical access hospitals, local health departments, extension offices, migrant clinics, and FQHCs about the types of services available to address 8 identified health behaviors. The 8 identified health behaviors in our study were sun or UV exposure, sleep-related services, nutrition or healthy eating, physical activity, mental health, tobacco cessation, alcohol and substance abuse, and opioid abuse. Respondents were invited via email and the postal service to complete the online Qualtrics survey, which included 46 questions. Qualtrics was the online platform we used to create the survey. After asking about the types of services the organizations provided, we also asked additional information which described the format of the services, the barriers of delivery, and the perceived importance of providing these services, along with the confidence of the organization to provide them. We surveyed organizations in 75 rural counties, which we identified using U.S. Census Bureau information. Our results showed that 51 counties were represented in the data by at least one participating organization responding. Respondents identified nutrition and healthy eating related services were most often provided at 95.8%, and sleep related services were least often provided by these organizations at 49.5%. Organizations who did provide services were most likely to offer health education related services via print or social media over the other type of service, such as treatment, diagnosis, or one-on-one or group education. The top barriers to providing any type of service on any of the 8 health behaviors were lack of financial services and lack of personnel, which makes sense based on what we know about workforce shortages in rural counties. Agencies and organizations that serve farmers may be unaware of the existence or lack of health behavior services available to their clients. We hope that these findings help identify gaps in services and that stakeholders and organizations can use this information to determine priorities and avoid duplication of efforts. We would like to use this information as a platform of collaborative work on future farm wellness projects and prompt joint efforts to improve the health of farmers and farm families in rural Ohio. For more information, feel free to contact me at drurup.23@osu.edu. Thank you. Public health officials have long recognized the need to address rural health disparities. In this study, we evaluate health behavior-related programs, resources, and services available to farmers and their families in Ohio's rural communities. Farm and rural populations have higher rates of age-adjusted mortality, disability, and chronic